Welcome to Unit 7. We are devoting Unit 7 to workflow interoperability and the study of workflow and process improvement for value-based care. We acknowledged in an earlier unit the importance of workflow interoperability, which must begin with understanding workflows and processes and how to improve them so that as we interoperate with other stakeholders, our workflows will not only mesh with one another's, but will help us perform processes that lead to improved quality and cost of care. While perhaps not the most exciting topic, workflow and process improvement may be the most important aspect of interoperability to fix. So in this first lecture, we're going to review workflow and process theory, providing a primer on how to conduct workflow and process improvement in the least disruptive way with the best possible results. The second lecture in this unit will offer real-life case studies in workflow, received directly from 4 patients and some reported in the literature. These are actual experiences of persons where workflows went bad, and one that actually worked, although within the last year or less. They represent provider organizations to be unidentified across the country from the East Coast, Midwest, and West Coast. All were described explicitly by the patients who experienced the issues associated with these workflows. While 3 of the 4 patients interviewed for their case studies work or have worked in healthcare directly or have worked in health-related fields, all could identify issues and their consequences to the healthcare system, which should tell us that workflows are indeed visible to patients who do in fact alter their choices of providers as a result. In looking at the workflow case studies, we'll identify the impact of the issues on value-based care. Let's start off this lecture with some level setting on terminology with respect to workflow and process. Terminology sometimes varies by the discipline within which process improvement takes place. For example, business process improvement is often used in manufacturing and other industries, where in healthcare, workflow and process improvement may be used instead, especially to emphasize its broad relevance to improving both clinical and business processes. Sometimes workflow and process management is used instead of workflow and process improvement to suggest a more ongoing activity, especially when the result of improvement is the use of automated workflow systems. There are also specific analytical processes which may be used to formalize and enhance workflow and process improvement, such as Lean, Six Sigma, and others. For this MOOC, we are going to focus on the generic basics of workflow and process improvement, to which analytical processes can later be applied. Workflow and process mapping, sometimes also called charting or modeling, is the process of analyzing and improving on workflows and processes. And maps are the documentation that results from analyzing and improving workflows and processes. Mapping may be performed in a way that is as simple as making a list of steps, aided by various diagrammatic tools, or even performed using various computer applications. Such computer applications incorporate a workflow programming language designed not only to aid in mapping, but to improve visualization, simulate variations, and learn about their effects, and even to guide end users on following workflows once they are established. This typically being called automated workflow management. For this course, we're going to approach mapping from the middle ground. Not just the simple steps, but not the most complex software. We're going to introduce diagrammatic tools since most automated systems embed these tools anyway, and each automated system has unique variations that we would not be able to simulate in a course such as this. Getting to the crux of workflow and process, the term process, sometimes also called task, refers to the manner in which work to be completed to achieve a particular result is performed. Workflow, on the other hand, is the sequence of steps, decision points, and handoffs within a process. For example, medication reconciliation is a process that is performed at each transition of care as patients move throughout the health system in receiving their care. At the time the patient is admitted to a hospital, for example, medications the patient is taking at home are compared with medications being ordered for the patient. Medications are powerful therapies that represent the potential for significant harm that can be caused if not properly ordered and administered. This is especially true in the hospital environment. If the patient was taking a certain medication at home that needs to be continued during the hospitalization, but was not included for some reason on the admission order, the patient could be harmed. Likewise, if a medication the patient is taking at home could interfere with recovery from surgery, for example, the medication may need to be temporarily discontinued. At the point of discharge, another transition of care, the medication should again be reviewed to determine what medications previously taken at home should be reinstated, what may be dropped, and what may be added. Although medication reconciliation has typically encompassed the hospital admission to discharge, in value-based care there is a need to extend this process across the continuum of care and to include patient compliance with the medication regimen. Medication reconciliation at every transition of care is not easy to do. Very prone to error, especially as patients who would be the primary source of the information that medications taking at home may not be focused on this as they are experiencing pain or may even be comatose. And yet, it is so important that it is the subject of considerable workflow analysis and redesign. Now let's take a look at the steps in workflow and process improvement. Workflow and process improvement is not a new concept for healthcare. Clinicians readily can tell you what is wrong or what they don't like, but the process of identifying ways to make improvements is a new skill for many clinicians. Process mapping for knowledge workers is especially difficult because knowledge processes are performed mentally. Clinicians rarely want to spend time mapping processes, and others who do process mapping for clinicians can't see the mental processes. In fact, part of the issue with EHRs offering clinical decision support is this issue of computer programmers not really understanding clinician mental processes and clinicians themselves not knowing how to address their needs. But in addition to getting health IT implementations designed correctly, process mapping is a powerful change management tool. When individuals involved in a process are able to step back and critique, as opposed to criticize, their current processes, they soon recognize the many workarounds and other problems their processes have, and not always due to poor practice but necessity, and how much they need help. There are a number of steps in workflow and process improvement, and again, these steps reflect a systems approach. There are 15 of these steps. The first one is build cohesive teams of individuals who actually perform the process. Second, orient team members on purpose of process improvement. 3. Select tools and instruct team members on process improvement methodology. 4. Map current processes, including workflows and information processes, but avoid identifying opportunities for improvement prior to completely mapping current processes. 5. Obtain baseline data using statistical charts as necessary to define expectations for change and for use in benefits realization studies. 6. Identify problems needing improvement. 7. Determine the root cause of problems. 8. Redesign workflows and processes. 9. Document changes in an improved process map. 10. Apply principles of goal setting and change management to adopt the new workflows and processes. 11. Test new workflows and processes. 12. Train all on new workflows and processes. 13. Incorporate changes into policy and procedure. 14. Monitor goal achievement. And 15. Celebrate success. Change correct course as necessary. Now we will discuss each of these in turn throughout the remainder of this lecture.